Hey everyone, welcome back to the New Generation Massage Therapist podcast. Today we're talking about something that I know creates some frustration for a lot of massage therapists, and that's using movement in our practice. I hear it all the time. Jamie, I'm not a personal trainer, or I don't have access to fancy equipment or a gym at my clinic, or that's not really my scope. Well, I'm here to tell you, nothing could be further from the truth. In fact, if we want to help our patients build resilience, we should be using movement every single time a patient comes to see us. And I'm going to break down three specific types of movement that you can start using immediately. No gym required, no personal training certification needed. These are tools that fit perfectly within our scope and actually amplify the work that we're already doing. If this sounds interesting to you, well, keep on listening.
Hey there, I'm Jamie Johnston, and you're stepping into a new era of thriving as a massage therapist. We're embracing who you are, pursuing what you love, and confidently shaping your practice. We'll challenge industry norms, spark change, and discuss what truly matters. Things like mental health, evidence-based practice, and some topics we've long avoided. Let's create better outcomes for our patients and happier, more fulfilling practices together. Welcome to the New Generation Massage Therapist Podcast.
So, before we dive into the three types of treatment, I want to address something really important. For years, many of us have been taught that our value as massage therapists comes from our hands-on techniques. We take course after course, learning new modalities, new ways to touch people, new ways to manipulate tissue. And don't get me wrong, hands-on work is really valuable. But here's what happens. We end up thinking that the only way we can help people is through what we do to them on the table. And that creates a few problems. First, it puts all the responsibility on us. If the patient doesn't get better, we think we need to learn another technique or take another course or just find that magic bullet that's going to help people. And second, it keeps our patients passive. They lie on the table, we work on them, and they leave thinking that they'll only get better because of what we do to them rather than with them. And third, and this is the big one, it doesn't build resilience. It doesn't give them the tools and competence they need to manage their own pain and function better in their daily life. That's where movement comes in. Movement is one of the most powerful education tools we have. It shows people that they're not broken. It demonstrates that they're capable. And it gives them agency in their own recovery. So let's talk about the three types of movement you should be incorporating. The first type of movement I want to talk about is what I like to call adapted movements. And these ones are great to do as a part of your assessment before the person even gets on the table. The real value here is that we're using movement as an education tool to show people that they're not broken. And this is especially valuable if the person is dealing with fear avoidance. If you remember, it's that belief that more movement will equal more damage or more pain. One of the best ways to do this is by using closed chain movements. Now, if you're like me, you might need a quick reminder of what that means. A closed chain movement is where a part of the body is fixed to something stable, like the ground, a wall, or your treatment table, and the rest of the body moves around it. So let me give you a couple of examples to see how you So let me give you a couple of examples so you can see how simple and effective this really is. Say someone comes in with limited rotation in their shoulder. Here's what you do. Have them stand at the corner of your table. Raise the table high enough that they can plant their hand on the corner, palm down, finger spread. Now, with their hand planted and their shoulders staying in the same position, have them walk around the corner of the table back and forth. What's happening here? The rest of their body is walking around the shoulder joint rather than the shoulder actually doing any work or rotation. They're getting that rotational movement without the fear or the pain that comes from actively rotating the shoulder themselves. Here's another one. Say someone can only move their shoulder to about 90 degrees of flexion. So basically their hand is straight out in front of them, parallel to the ground. Have them move their hand straight out in front and press their palm against the wall. Now have them take a couple steps backwards, bending at the hips until their upper body is in line with their shoulder. It should look like their arm is parallel to their ears, giving them around 160 to 180 degrees of flexion. Then have them back away from the wall and stand up straight. They'll see that increased flexion. Then have them slowly lower their arm down to neutral. And here's what's really cool. Inevitably, not always, but most of the time, you can have them actively move their arm back into flexion again, and the range will have increased, sometimes quite significantly. Now, as you try these kind of movements, communication is absolutely critical. So here's some of the prompts that I like to use. I'll just say, move into this position until you feel a little bit of discomfort. We don't want pain, but a little discomfort's okay. And then I'll ask them, do you feel safe doing this? If so, keep breathing throughout the movement. Don't hold your breath or tense up. So you might do the same movement with them a few times. Maybe the first time they only increase the range by 10 or 20%, but then each time after it increases a little more until you work up to full range. You may not always get them to full range of motion in one session, but you'll likely help them increase it. And more importantly, you're giving them the confidence that movement is safe and that they're capable of doing the movements they were once worried about. And that confidence you're building, well, that's what builds resilience. All right. The second type of movement we need to talk about is isometrics. Now, as I mentioned before, if you're anything like me, you don't necessarily commit a lot of these definitions to memory. I mean, I'm fortunate that I teach this stuff so I remember what an isometric is, but I quite often have to look them up just to remember them. But an isometric contraction is where a muscle contracts, but neither lengthens nor shortens. So the joint doesn't move. It's just a resisted contraction with tension. And here's why isometrics are so valuable. They're a powerful analgesic. Research shows that after isometric arm and leg exercises, pain tolerance increases and temporal summation, that's the increase in pain perception over time, decreases. And get this, not only at the areas being exercised, but also in other areas of the body that weren't even being assessed. This tells us that there are central or systemic mechanisms involved in decreasing pain through isometrics. It's not just a local effect. Other studies have shown, excuse me, that pain thresholds increase significantly during an isometric contraction, even at just 21% of effort, and remain elevated during a 5-minute recovery period afterward. Now, a lot of the studies demonstrate that movements have to be done for extended periods with major contractions to get the full effect. But here's the good news. You can get some pretty good effects with just a 5 to 10 second contraction at about 10% of the person's strength. So you could do this before your treatment, during your treatment, or after your treatment. And not only does this help with pain reduction, but it also demonstrates to the person that they have the capacity to do the movement, and that helps reduce disability. So, what does this look like in practice? Well, let's say somebody comes in with knee pain. You could have them sit on your table with their leg extended, and then just place your hand on their shin. Ask them to push against your hand, not hard, just about 10% of their strength, and hold for 5 to 10 seconds. Or someone with shoulder pain. Let's say shoulder flexion is limited. We'll go back to the example we used before. During the treatment, have them move their shoulder into flexion until they start to feel some discomfort and stop there. Then just push your hand against their forearm and have them push into it. Then hold that pressure for 5 to 10 seconds. After the contraction, see if they can comfortably move the shoulder a little bit farther. Simple, effective. And when you combine the calming effect of massage with incorporating isometrics into your treatments, you can have some pretty profound effects on pain. Now, the third type of movement, and this is something great to recommend as home care. This kind of movement we call mindful movement. Now, mindful movement is a bit different than what most people think of as exercise. It's not about grinding through reps or pushing through pain. Instead, it's about moving slowly and intentionally while paying attention to what's happening in your body. Think of practices like Tai Chi, Qigong, or yoga. These are all forms of mindful movement. What makes them mindful is that they combine three things: physical movement, focused breathing, and present moment awareness of what you're feeling in your body. The key difference here is that you're not just moving for the sake of moving. You're training your brain to pay attention differently. You're learning to notice sensations without immediately judging them as good, bad, safe, or dangerous. And research shows that mindful movement is incredibly effective for managing persistent back pain. And here's why it works so well. First, it actually reduces pain intensity and disability. Studies that compared Tai Chi, Qigong, and yoga to standard physical therapy found that these mindful practices were more effective at reducing pain. Tai Chi, in particular, seems to have the strongest effect, probably because it emphasizes an upright posture and neutral spine without all the bending that might aggravate someone's pain. But here's what's really interesting, and this ties back to everything we talk about with the biopsychosocial model. Mindful movement actually changes how pain is interpreted. See, persistent pain isn't just about tissue damage. It's heavily influenced by our emotional response to pain, the fear, the frustration, the catastrophizing. When someone's been in pain for a long time, the pain experience becomes amplified. The sensation and the emotional reaction become tangled together. So, mindful movement helps untangle all that. It trains you to separate the physical sensation from the emotional reaction. Instead of feeling pain and immediately thinking, oh no, something's wrong, this is terrible, it's never going to get better, you learn to notice the sensation and respond to it more calmly and intentionally. You're literally retraining your nervous system to interpret the pain differently. You're shifting from a place of struggle and fear to a place of acceptance and informed response. And here's something really cool. Regular practice of mindful movement can actually change the structure and function of your brain. We're talking about real neuroplasticity here. Brain regions involved in pain regulation, like the anterior cingulate cortex and the insula, start to function differently. This is especially important for people dealing with central sensitization, which is super common in things like persistent low back pain. That's where the central nervous system becomes hypersensitive and starts amplifying the pain experience way beyond what the actual tissue damage would warrant. Mindful movement helps dial that down. It also reduces rumination, that constant loop of worry and negative thinking that makes pain worse. When you're focused on the present moment and what you're actually feeling in your body right now, you're not stuck in that default mode network of the brain that constantly is spinning stories about how bad things are or how much worse they might get. And here's another piece that I find fascinating. Mindful movement helps correct movement habits that can actually contribute to persistent pain. A lot of persistent pain is maintained by unconscious habitual muscle contractions. Your nervous system is holding tension without you realizing it. So, mindful movement practices like the Feldenkrais method, for example, teach your nervous system to let go of those habits. There's research showing that mindful movement can increase hamstring range of motion, not by forcefully stretching the tissue, but by training the brain to release persistent muscular contraction. The limitation wasn't structural, it was neurological. The person was habitually guarding, and once they learned to let go of that habit, the range of motion improved. So when you move slowly and with attention, you start to notice the difference between effortful, painful movements and more efficient, pain free alternatives. You're literally learning better coordination and movement patterns. So let's break down what mindful movement does. On the physical level, it strengthens the area, and this is especially with Tai Chi, and it improves flexibility by releasing chronic tension rather than forcing stretches. On the cognitive level, it reduces pain catastrophizing and shifts focus away from fear of movement. Remember that fear avoidance model that we've talked about earlier? Well, this directly addresses that. And on the neurological level, it desensitizes the central nervous system and changes how your brain interprets the pain experience. And on the functional level, studies show it can significantly lower pain disability scores. People can get back to their daily activities with less interference from pain. The bottom line, mindful movement is one of the most powerful tools we can recommend for home care because it addresses pain from multiple angles at once: physical, mental, and neurological. And your patients can start with just a few minutes a day. So, how do you actually recommend mindful movement as home care? Well, here's the beautiful thing: you don't need to be a yoga instructor or a Tai Chi master to guide your patients in this. You just need to teach them the three simple principles they can apply to any movement that they do at home. First, we want to encourage them to move with less effort, not more. And this might sound counterintuitive, but tell your patients to dial down the intensity. Think of them doing tasks at home like unloading the dishwasher. They should move with minimal muscular effort, just enough to do the movement, nothing extra. Why? Because when you reduce all that noise of heavy exertion and straining, you can actually feel more. You can detect smaller, subtler sensations in your body. It's like turning down loud music so you can hear someone speaking. Less effort creates more awareness. Second, encourage them to look for something new every time. So think of them getting on the floor to play with their kids. Don't just mindlessly repeat the movement of getting down on the floor or getting up off the floor. Instead, encourage them to actively look for something different in every single repetition. Maybe they notice the exact moment that their shoulder begins to lift, or how their weight shifts from left foot to right, or where they feel tension starting to build. The goal isn't perfection, it's curiosity. What can you notice this time that you didn't notice last time? And third, you want to pause before you react, or encourage them to pause before they react. And this is probably the most important one. Teach your patients to catch that first automatic impulse, that habitual racing pattern, and choose something different instead. When they go to bend forward and feel that urge to tense up and guard, can they pause for just a second? Can they take a breath? Can they choose to move with a little more ease instead of that automatic protective response? These three principles can be applied to anything: getting out of a chair, reaching for something on a shelf, even brushing their teeth. It's not about adding another thing to their to-do list. It's about bringing awareness to movements they're already doing. You could recommend that they start with just 5 minutes a day of mindful stretching or gentle movement, or even point them towards beginner Tai Chi or yoga videos online. The specific practice matters less than the principles. Move with less effort, notice something new, and pause before reacting automatically. So here's what I want you to take away from this episode. We've covered three types of movement that every massage therapist should be incorporating, and none of them require you to be a personal trainer or have a fancy gym setup. Adapted movements, using closed chain exercises to show people they're not broken and movement is safe. Isometrics, creating those muscle contractions that reduce pain systemically and build confidence in their capacity to move. And mindful movement, the perfect home care recommendation that retrains both movement habits and the person's pain experience. When you start integrating these three types of movement into your treatments, you're not just providing temporary relief, you're building resilience. You're preventing disability. You're transforming from a well-meaning but modality-trained therapist into a new generation massage therapist who creates lasting change. So, I want to challenge you. Pick one of these three movement types and try it with your next patient this week. See what happens. Notice the shift. And if you want more support like this, practical, evidence-based strategies you can implement immediately, I'm putting together something special for you. Stay tuned to future episodes where I'll be sharing more about how you can dive deeper into incorporating more movement into treatment and becoming a new generation massage therapist. Thanks for listening, and I'll catch you next time.